Welcome back to Green Living with Tea. And today we are diving deep into the true foundation of wellness, and that's lifestyle medicine and proactive prevention. And joining us is an absolute powerhouse in the holistic health space, Dr. Jacqueline Patterson. And she is an internationally recognized naturopathic physician, three-time Amazon best-selling author, and Forbes contributor. And as the CEO of Fairfield Family Health in Fairfield, Connecticut, she brings over 16 years of clinical expertise helping patients reverse chronic conditions and build resilient, vibrant health. And in this episode, we are unpacking how simple, intentional daily habits can possibly prevent disease or reverse disease, balance your body, we will talk about, and protect your family from modern environmental stressors. And before we jump into this life-changing conversation, remember to hit that follow button on Instagram and leave us a review on Apple Podcasts, which will help spread the word about green, natural living. And get ready to take notes. And please welcome to the show, Dr. Jacqueline.
Thank you. Thank you for having me. Really looking forward to this conversation.
And I said before I was going to mess your name up, and I just did. Dr. Jackal. It's
Jaquel.
not
Yeah. It's like
Jaquel.
Raquel with the J. That's the easiest one.
Sorry.
Don't worry, everybody does it.
I know. I get Teresa. I get Terry, so I get it. That's why I go right with T. It's just
Uh-huh.
easier.
Mhm.
So my first question, I love history. I love figuring out, how did you get to where you are today? Was it in your blood that you went to, med school, or was it a fluke, or was it something else?
Yeah, I actually was one of the people, several different reasons, like life situations, but I always had an interest actually in integrative medicine since I
Mm.
was a kid. I always say I like made my brother do all my remedies and concoctions and all the things, older sisters do. So I had an interest, actually went to Cornell undergrad as plant sciences because I had an interest in herbal medicine,
Mm.
but I was kind of told to go the allopathic route because in that route at that time, that was like 25 years ago, there wasn't a thing like functional medicine or integrative medicine. So I was told,
Right.
that's quackery. There's nothing you can do with that. And because of that, I changed to like economics because I'm like, what do I actually do with this if I can't go into the conventional route? Also, my mother got really ill when I was 15. She was later diagnosed with lupus, and I became really disillusioned with the healthcare model. And I was like,
Mm.
that is not a model I could see myself going into. So, fast forward, I worked for a few years, learned about naturopathic medicine. I randomly got like some flyer advertised something. I think it was something like that in the mail, and I was like, oh my God, this is exactly what I wanted to do. I just didn't know what it was called. So after that, I went back, took the medical requirements, and enrolled in my naturopathic program. And so I always tell people every experience you have kind of happens for a reason. And
Mm.
I ended up going full circle back to what I had always been interested in. I just didn't know what it was called. So,
Wow, fascinating. And Cornell University, by the way, I went to Ithaca College.
oh, you did.
Yes, I
I'm
did. I
going
spent
back next year actually for the reunion.
awesome. Yep,
Been
I
a
go
while.
quite often because I'm only 2.5 hours away. But if I knew there was something called plant sciences, I might have gone that route. I actually went the route of a business major and a minor in health. I graduated in 85, so I'm 63. But my whole business plan coming out of college was to open up a health food store that as Whole Foods. And I came out with this huge business plan because in 85, there were only little tiny little co-ops all around, which is where we shopped. And that business plan, unfortunately, I did not do that. I went the party planning route, and I have a party and wedding planning business for
Event.
40 years. So
But it's
here
still
I,
in your heart in terms of like that's why I said it's like everything
yes, yes,
happens in
for a
some way
reason.
that's for a
Hmm.
reason. It's really
Yep.
interesting.
Yep. Well, I started the podcast when COVID hit, and I said, you know what? I want to go back to what I really am truly passionate about. And I've never lost sight of this. And I've helped people through the past 40 years try to avoid toxins as much as possible. But this is about you, not me. And I want to hear more about what your practice is, because I love talking to integrative medicine practitioners, because your information is so invaluable to people that need to understand what it is that you do and how you do it. And because a lot of people go to a general practitioner who they are trained to basically give you a pharmaceutical drug for your symptom, not try to figure out what is going on with your body. So what is lifestyle medicine, if somebody's listening here?
Yeah, so if you look at some of the tenets, so lifestyle medicine is definitely much more on prevention focus. So when we look at
Mhm.
naturopathic medicine, there's like six core principles, and one of them is like prevention. So we're preventing the fact of illness. But when we look at naturopathic medicine, in our core philosophy, it's to get to the root cause, the underlying cause of disease. And the reason that's important is because, to what you said in the allopathic model, it is okay, you have this and we give, XY, we give this medication. But with a natural as a naturopathic doctor, and also people that are functionally medicine trained, we are learning from day one that, if you're imbalanced with your hormones, maybe that's going to cause information issues with your brain health. Maybe that's going to cause issues with your endocrine system, your thyroid system. How do hormones get metabolized, like through your liver and your gut? And we're going to be looking at all these different organ systems to improve health, rather than just putting you on birth control pill. I've had
Mhm.
patients that's a perfect example where we've worked on gut health and they had IBS or constipation, and magically, I'd say magically, their hormones were much better managed. They had less pain, they had less cycle issues and things like that. So that is how our approach is different. We're not just looking at symptom management; it's really looking at everything. And in lifestyle medicine, the focus particularly is more on like prevention. What can we actually do to prevent the disease condition in itself, or at least manage it in a better way?
Yeah, have you seen a shift at all in the past, decade or whatnot, of uh, lifestyle medicine prevention in the medical field, or is it still pretty controlled by the pharmaceutical industry?
I think it is starting to transition, because they now have a like fellowship where you can get lifestyle
Oh,
medicine trained, for example, and certified, which didn't exist. I think that's been in the last like five years or so. And I think the other thing is the demand is a lot higher. Like there was always
mm,
an interest in integrated medicine even like 20 years ago, but I think now, especially with this new generation, if you look at this new generation, they're much more into longevity. They're much more into biohacking. They're much more interested in. I think I read an article recently that restaurant or I read an article recently that restaurants were struggling now with alcohol sales, because this generation
mm,
doesn't like to use alcohol as much. They're much more health conscious. So I think that
interesting.
also it's a mix of the doctors have to be more proficient and knowledgeable, because the demand is there. And I think as it's becoming more like the cool thing, versus before it was kind of a little bit more woo woo.
Yeah,
The
right.
baby crying in the background. It's
I
a little
love it.
bit more, it's a little bit more like kind of can seen as woo woo versus considered as lifestyle medicine.
Yeah, believe me, growing up, we were the granola heads. They thought we were woo woo. We lived this life for our whole entire life, all five kids. We do preventative medicine all the time. So I get that, but I have seen a shift. I've seen, I just yesterday I was telling my girlfriend about arnica for her bruised ribs. And she ordered some. I'm like, okay, that's a big step in the right
That's
direction. Is
change, yes.
right.
Or
Anyway,
people having heard of it, they're like, "Oh, I know what arnica is," whereas before
right.
it wasn't like that. Or people that are just very like skeptical, people just being open to now, like, "Oh, I'll do acupuncture. There's benefits of acupuncture."
Yes.
So I think all of those little things are what's shifting the course.
Yes, 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 I agree. And a lot of things are. So you work a lot with complex chronic illnesses like Lyme disease. And here we are in summer months. You hear a lot about it because of uh, the tick bites that people are getting. I guess ticks are just outrageous right now, and autoimmune conditions. And how much does a person's daily environment play in triggering or preventing these issues?
So right now, I mean, it's at a high really in the past few years. Lyme disease has already been there for a while, but it's getting more, one second. It's
Take
getting
your
more
time.
awareness as I'm talking. It's getting more awareness, I think, as there's more research coming out. So there's been
Mhm.
some conversation about there's a lot of different subspecies, et cetera. So a lot of times when I'm working with a patient, working on a lot of things when they're going outside, especially if they're active outside. However, one thing people don't know is that you can have the 70 to 80% of the Lyme cases that get transmitted are from nymph ticks, which is literally the size of a poppy seed.
Oh my
So the
God.
reason I like to say that is because people are expecting, those huge ticks. And oh, I have patients say to me all the time, I never saw anything on myself. And you're like, okay, but 70 to 80% of cases are. And that's the reason why, because a lot of people don't recognize or see it. Like I remember when it was a summer, like a few years ago, and I thought I was tying my shoelace. I had shorts on, luckily, and I was like, oh, what's that new tick from? Or not tick, I'm sorry, freckle, because I have freckles. So I was like, oh, I didn't, and I was like, oh my gosh, holy crap, that's a tick. It was an embedded tick. So that's
Oh
my
my
point of
God.
saying that how small it could be. So and that was I wasn't even outside. I think I was on a patio. I wasn't on the grass or anything like that. So I like to let people know because nymphs are also lower. They're not like on trees and the location. So I'm often working on like the education around it, making sure if you go outside a lot wearing like white so you can actually see it. They like
Mm.
to burrow in areas that hide, like your scalp, your groin, your underarms, places that people wouldn't normally see. And then the other thing I like to say is they can also present differently on the skin. People know of just the bullseye rash, but only about like 40 or 50% of people get the bullseye rash. It can also almost look like a spider bite. Um, it can have different presentations, especially on different skin types. So that's the thing to know. As I tell people, if there's kind of a sudden you're outside, you're or there's any kind of acuity of symptoms, you're getting like fever, fatigue, joint pain, things that feel very severe overnight, you definitely want to look in like tick-borne infections like Lyme disease or Bartonella or Babesia. There are other co-infections. And then when we're looking at so that's going to be really important that I'm like educating people on
Mhm.
is like especially as the season changes and you can get it year round. So there are cases found every single day. The highest is in the spring to summer because that's their reproductive time. So there's going to be a lot more availability of it at that time. And also, we're also outside more often.
Right, right. And what are like I mean, I have a dog. I walk in the park every morning. I'm always fearful and of because you just hear all these horror stories. Is there and oh the baby?
She keeps. I was just telling her before we got on that my baby was due for a nap, and so she's fighting it. So that's why you'll hear some little sounds in the background. But 45 for my first baby, so it's been different.
I love that. I love it. Did you have trouble? No, of
Yes, I
course
know. But
you're.
I have my dog. So my dog. Speaking of your thing with dog, I'm always
Yeah,
constantly checking, and my dog is obsessed with being by her all the time. So.
I love it. So dogs, babies, you might hear in the background here, and we welcome those noises. They're really beautiful sounds to my ear, and if anybody hears them, you know what's going on. We don't have to hide it.
There's
So
no guessing, yeah.
no guessing. That's right. So if somebody like I always think boost my immune system if I ever were to get any kind of
Mhm.
whether it's Lyme or something. I always feel like it's like basically a preventative shield to help. And so my whole thing is as few environmental toxins that I can come in contact with, whether it's in my house, what I bring in the house, what we eat, the water we drink. Those are all once I walk out the door, I am not protected, right?
Exactly.
And I would imagine in your work, it's those are some priorities. Are there certain things, or maybe some of the top things you can tell
Oh,
people to
yes.
how to prevent or
Yeah, some of the pieces you want to make sure is the first thing I say is like what are you consuming all the time, right?
mm,
Most of we should be consuming water, right? So good amounts of water throughout the day. So having a good water filtration system is like one of the first things that's really important. Making sure your system is filtered. I know there's a lots of studies on people who have access to like well water. They tend to have higher. So if you're in a rural area, You want to make sure that there's no contaminants, in terms of checking your water. But areas like people that have well water, for example, there tends to be a lot more issues with what's in the water itself. So that's really important. Also, if you're located by like golf
Mm,
clubs and like other kinds of things, that was something I noted because of the fact that they're spraying a lot, right? So
hmm.
being mindful of even like picking where you live, your home, as you're looking at that, because those can have residues into water and such. So water filtration
Right.
is one piece. The other thing is mold. So one of the
Mm,
at our office, we see a lot of patients with terms of environmental exposures that have mold exposures. And the reason that's important is because mold can cause immune dysfunction and immune dysregulation. So someone that has illness, it could actually be worsened by mold because their system is not performing the way it needs to be. So I'm always asking people about that, especially if they're living in a older house, checking for that. And some of the symptoms of mold are like brain fog, fatigue, or just like constantly getting ill, sinus infections. I had patients where
mm.
the wife might be really, really tired and fatigued and have, but the husband thinks they don't have anything, but they had a lot of sinus issues, right? So mold is a big thing, especially in older house or if people that live in like urban areas. So people live in urban areas, lots of times they're older buildings. If you look at urban areas like New York City, there's a lot higher levels of pollution. So you're going to get exposed to like arsenic and things like that. So you want to just limit, like, how can you limit the exposures that you have? Obviously, if you live in urban areas, there's not so much you can do. However, you might be able to get a really good air filter, a HEPA
Mm.
air filter. You want to make sure you're mindful of not using a lot of like sprays and chemicals in the house, like things that you can prevent. Um, excuse me. Excuse me. So you want to make sure you're not doing like plugins, and they always come in too, excuse me. Um, Plugins and things like that in the house. I always get frustrated when I go to like hotels and places where they use tons of scents and perfumes. So those are things that you can do when they've looked at makeup and things that people put on themselves. I forget, like in terms of hundreds of like things we get exposed to in terms of the makeup that we put on our skin. So for women, how do you use like clean makeup or to use less of it? If you look at other countries, European countries, they spend a lot more on skincare and quality of skin, and Americans spend much more on makeup and covering up. But those things also often are also ridden with a lot of like environmental toxicities and things that are not good for our like skin health that get into our system. So looking at things like makeup, looking at things, avoiding scents and perfumes as much as possible, having a good, really good water filtration system, looking at, to your question, like places that where you live or reside, are there abilities to make choices around that? And then things like a HEPA filtration system or HEPA a cleaner. But if you are limited with that, you just try to reduce the exposure as much as possible. And then there are other also supplements that I'll give patients like glutathione,
Mm.
NAC, things like that that help to support phase one and phase two of the liver, that help with environmental exposures if you have them. So I'll have patients that are in those areas on those more at a regular basis. And then vitamin E, selenium, vitamin C, these are all protective things too, as well, for these exposures that somebody might have.
A lot of information in there, a lot
Mhm.
of great information.
Thank you.
Absolutely. I mean, I have indoor air quality monitors that I bring to people's homes just to show them what could be in their homes. And I think that's so, all the information that you just said, purify your water, purify your air, and bring in the least amount of chemicals as possible. I mean, I was brought up cleaning with, we had our chores. We had to clean with water and vinegar and baking
Oh,
soda.
yeah. Hmm.
And that's pretty much what I still clean the house with. I throw in a little bit of Dr. Bronner's here once in a
Hmm.
while. And I think what I tell people is it can be overwhelming, but making one small change at a time is a step in the right direction, because I'm sure in your practice you talk about how we in this day and age we are on a toxic overload.
100%. And it's only getting even worse when you look at the AI centers, the data centers,
Mm,
like all of these other exposures that we're getting. constantly. It's even more, and that's why lots of times I do have to have patients on, the regular, some of those antioxidants because we become depleted, and many of these antioxidants that protect us because antioxidants help with like inflammation, they help
Mhm.
with radicals, all the things that happen as a result of pollution and exposure. And then I'm looking at things like a glutathione or NAC2 to support them. So it's really important to decrease as much as your toxic burden, looking through, basics, food. I didn't discuss that and how
Mm.
we're, what food choices we're making and making sure. I love what you mentioned about cleaning. That's the same I use is vinegar, water, and baking soda, the same thing.
Yep.
So much so that I don't know if you noticed too, I feel like as you start removing, these chemicals and things from your environment or perfumes and things, you're much more heightened when you're in places, right, that have that. When I go to a place and I'm like, oh my gosh, at a restaurant and the chemical smells are so
Yep.
strong when they're not needed. And then when I go to France, they don't use the same product.
Nope.
So it's really interesting. Actually, when I went to France the last time, you saw them using a similar, it was like vinegar. I'm like, I know this smell. This is the smell that I have at my house. It's
Yeah,
the same
yeah.
product. So so much so that I was like actually trying to find out if I can go buy it in the store so I didn't have to make it because I was like their products were a lot cleaner. So as much as we can do, and then we do the protection by supplementation as much as possible. That is definitely a huge conversation that I'm having with patients for every visit, especially if they're not recovering in their illness, where there's kind of
Mm.
things that are like kind of held up. We want to see are there other factors that are causing that, which is again going to the root cause and the underlying cause of disease.
Okay, by the way, I make an all-purpose cleaner. I'm going to send you a bottle of it.
Oh, you do?
I
Okay.
do. I do sell it. I had a manufacturer, very small. I mean, I am such a small little,
I love it.
but they went the CBD route. So now I'm back to making it out of the basement of my home when somebody wants it. But it is vinegar, water, and essential oils, and it's
Oh,
perfect
with
for.
essential oils,
Mhm. And essential oils have natural
antimicrobial
but yeah,
properties.
properties, yeah, antiviral too, for that matter. Yeah, that was an advertisement for Teas
Oh
Organics,
yeah, I'd
but
love to. I definitely love to because I was like, and it's odd that they don't sell anything. If you go to Whole Foods or any of the health food
no,
stores, they're clean, but they still have a lot in it instead of
yeah,
just simple ingredients. Like you can
yep,
have 4 ingredients. So
exactly. And mine's in a blue glass jar. If it's essential oils, it really needs. So you got to be careful, obviously, when you're cleaning. But
yes.
I'll send you a jar of that.
Oh yeah, I love that. Thank you.
And so, through my mind, when you were just talking about all that, you must have your clients go through quite an extensive, I would imagine, lab work.
Yes. So that is one of the things in how we definitely are different is that first of all, our visits are like 90 minutes usually when we first see someone. So I always think that part of the reason there's a lot of misses in healthcare is because if you only have 8 minutes with a patient,
Mm,
first of all, no doctors want. So I always like to say, like, no doctors want to meet with the patients for 8 minutes. So that's the piece. Just the way the model of healthcare is, that's the way it's built. So what happens is you have to see a doctor like 10 times, oftentimes, before they really have an understanding of you, who you are, your situation, the right blood work, etc. Now, if you're meeting with a patient like us for 90 minutes, I'm getting so much more information
mhm.
because I'm finding out, not only their disease condition, but like when did it start? What's their health history? So many more questions that and much more extensive blood work that you're not going to get if you meet with someone for eight
Right.
minutes. It's unfortunate. So yes, we're gonna do a lot of, I'm gonna look at like nutrient status. I'm gonna look at just obviously the general, the CBC, check their liver, cholesterol, but then we might check like if there's a family history of high cholesterol, we might test not just regular cholesterol. We might check apolipoprotein A, lipoprotein A and B, and get more information on them. Instead of just glucose, we might test fasting insulin and also obviously do the A1C, which oftentimes they don't do unless there's something wrong, which is the 3 month glucose check. I'm gonna check. I'm gonna check iron and ferritin, not just a complete blood count where we're checking red blood cells. I'm going to check not just TSH for thyroid. I'm going to look at free T3, free T4, total T3, total T4. We might check their thyroid antibodies more than once. So the data, the information we're going to get is way more thorough. Unfortunately, it might mean there's like 12 vials of blood when people do go. But we have a much bigger history. And so that's one. But then we might also do specialty tests, like do a stool test to see, do they have yeast in their stool? Do they have staph? Do they have strep? Do they have parasites? We might test their cortisol. What does their energy look like throughout the day? When you do it through blood work, you're only going to get a one-time snapshot. We might check for hormones and how their hormones are pulsing throughout the month, not just again a one-time snapshot. So we're getting way, way more extensive information. So it actually better serves the patient because we get much better, a much clearer picture of who they actually are.
So as I listen to all this, I think, oh boy, insurance. Insurance doesn't cover any of this, does it? And which
Well,
is
it does
crazy.
if you're doing through a conventional lab. So if you're doing through Quest or Lab, which is a Quest or LabCorp rather, which is probably 90% of the blood work I do. The specialty
Right.
tests, like I mentioned, the stool test, the cortisol test, those are at cost. So those you're right are out of pocket, and those could be anywhere from like $300 to $500. The other tests that I mentioned, I do all through Quest and LabCorp. That does definitely go through your insurance. Now, some people's insurance may, like if it's like Medicare, we might have to connect them with a different like a group, because NDs actually aren't licensed, aren't recognized by Medicare, which is kind of is interesting. So we might have to make a different situation for them, but for the most part, we can get a lot through like Quest or LabCorp. But some labs, like let's say I want to test for food sensitivity versus food allergy,
Mm.
insurance may or may not want to cover that. And so in those situations, we tell our patients to call just to confirm before they get it done and they get a surprise bill back from Quest. So.
Wow, very thorough, very interesting how it's all done. Do you see anything in the future that insurance might? I mean, I don't understand why they don't cover they functional medicine.
Yeah, so you're right. So you can, many doctors, they still in my space in naturopathic medicine do carry insurance. So we can often carry insurance. The challenge is in my struggle is that with insurance, sometimes they can limit, like you only need to have, you might not get reimbursed if you had too many visits with somebody in a year.
Mm.
Or you might meet with someone like I do for 90 minutes, but they're only going to reimburse you for 60 minutes. And they'll say, well, it's not warranted 60 minutes. You only need 45 minutes. So it's really hard to pay the bills basically doing the space of functional medicine
Right.
because, usually the model is 8 minutes. And in a conventional model, they might jam pack a doctor with 4 to 5 people in an hour.
It's
If
crazy.
we're doing that, right, in two people or one people an hour, we're only going to get reimbursed for 15 minutes, right? So it's very hard. It's hard. And so that's why a lot of them do cash base because the way the model is, the reimbursement is not really allowing for that. So that's really the tricky balance is that if not, you're gonna have to see people at that same level of frequency, which then again goes back to what doesn't work. So that's the challenge.
Yeah, and not to put down the pharmaceutical industry again, but I would imagine the pharmaceutical industry doesn't like functional medicine because it eliminates pharmaceutical
There's less of a
drugs
need. Yeah, there's less of a need for that until
for
there's a way to, yeah, there's definitely a less of a need because we're able to often work with patients and decrease the level of medications they're on. Or if I'm working with a young person, which I know I talked to you about before the call with like ADHD, potentially and
Mhm.
anxiety, and a parent comes to see me and they're like, hey, I'm trying to think of what options I could do before I need to get them on the medication. Well, lots of times I'm able to divert that and they don't need to be on anything. So, those kinds of medications, most people are on a psychiatric medication for their whole life. So you have a lifelong customer, you get on like some on a medication like Prozac, you're usually on it for the long term, especially if you get it at a younger age. So yes, I agree. I think there's different incentives for those things. And my goal when I work with a patient is getting what we talked about, like the lifestyle piece is important, especially as we transition. So I also don't believe in let's put people on like 40 supplements and they're on that forever. Sometimes I always say personally when I practice, I kind of load up till they're better and then I kind of like load down, like they might be higher. And then the goal over time is what are the things that you might not necessarily be able to get from food. Like our soil is really at a deficit for good minerals. So
Mhm.
you're probably going to have to take a multi-mineral your whole life and a vitamin. Probiotics, like I'm going to recommend basic things like that. fish oil. So there might be a handful of base things that have people on, but the ultimate goal for anybody, anyone listening in, if they're working with any naturopathic doctor, functional medicine trained person, or health coach, is really to not be on. The goal shouldn't be that you're replacing by putting someone on tons of supplements. You have to get to a point where it's for maintenance, and that there's a sustainability there too with somebody.
Yeah, a good balance somewhere.
Mhm.
Yeah, I get it. It's fascinating to me, and it's fascinating that nothing against our doctors. They're trained that way, and I'm being told that general practitioners are trained to give pharmaceutical drugs, and they have like 6 hours of training in preventative medicine.
Yeah, it's
So
very limited.
nothing against them, but this is how it is these days. I hope these things can change, and I'm glad things are shifting a little bit and people have options out there. And telehealth, I mean, since
Oh
COVID,
yeah, like 30% of our patients are through telehealth.
yeah,
Even though
and you
we're
do
based,
it through
yeah,
like a Zoom call, is that right?
exactly, through our EMR system through Zoom.
Yeah. So that's the beauty of, and anybody can work with your practice,
Hmm.
which is so great. You don't need to be in person,
Yes.
but you can always go to Fairfield, Connecticut. It's a lovely part of the
Yes,
country. I
it
love
is. And
Connecticut.
yes, and our practice, it grew a lot. So I just have did a full build out 2 years ago, and we had 4,500 square feet on the top, but the
Wow.
building is 9,000 square feet that we own. So we built it out to include wellness like sauna, IV therapy, cold plunge, red light therapy. And eventually like hyperbaric and those types of things. So we added those components. And then now I have about 8 other doctors that we all have our own kind of niche within the space. And the reason that's good is that like my area is more Lyme and psych, right? But then if someone has SIBO, for example, which is a GI issue,
Right.
there's one doctor that like focuses solely on that. So I'll be working with a patient, I can refer them to her, or they come in and they're like, I really have this issue. We kind of all have even though as naturopathic doctors, we can really see anything. It's weird. Even if you do, like I said, psych, you're still addressing every organ system anyway, but it makes it a little bit more, you're working with somebody that's more of an expert in particular areas. And so we've developed that in our office, and it's just a really great way to like collaborate together on cases as well.
I love it. What about women's heart?
Cardiovascular, that's huge. And
Thank
yeah,
you.
and we actually have one of the doctors at our office focuses, it's interesting you said that, very much on that cardiometabolic issues, but she has more of an affinity and interest on women's heart health because that often gets ignored,
Mhm.
and that gets expressed much differently for women than it does for men. And you have it's a high rate of cardiovascular issues and death for women in that age is like 50 to 60s, that
Yep.
kind of again, it gets expressed differently for women than men. And so one of the doctors, that's her particular area of focus, is cardiovascular health, but much more of a spin towards women and hormones too. And we have a couple of doctors too that focus on bioidentical hormone replacement therapy, or we have one provider that does that. We also have just on hormone health and the transition. So there's a big conversation about a lot of work around that we have in our office as well.
I love it. Fairfieldfamilyhealth.com. I encourage everybody to look it up, and wonderful website, and all these doctors not calling them doctors, but all the people that work there have their bios and everything on there. Uh, Dr.
Yeah,
Jaquel? Yeah.
Jaquel. Yeah, you got it
Yeah,
right.
yay. You are a sought after speaker and a published a book, three books you've
Yeah, 3 books.
published.
Yes.
You've been in places or been published in places like USA Today, New York Magazine. I mentioned Forbes, CBS, Fox, NBC, ABC. You might have seen her somewhere along the way. She's also past president of the American Association of Naturopathic Physicians. And are you currently on the
I'm
board
actually
still?
currently a president now. So I was the past president, and I'm an interim 1 year president.
Yeah,
So it's kind of funny. I don't know how that happened, but it did. But at the same time that I have my first child, but
I was
only
just
a
gonna
year.
say,
So I'm like 7 months in now. So we're
I
almost
was Well, you are an amazing human being, I have to
Thank
tell
you.
you. Just following you, reading everything about you, hearing you speak today, finding out you have a newborn baby, 45 years old. I give you so much credit, and I'm so honored that you came to speak with us today. Is there anything else that you would like to tell anybody?
Yeah, I just wanted to say something you touched upon earlier is just one thing. I always tell people it's just one thing, one, baby step. The same as the trajectory in getting well. Is like, what is that one positive thing that went in your right direction? Because it can get really sometimes
Mm,
discouraging for people, or
yes.
discouraging and also overwhelming. And so I love that you kind of said that earlier, and I always like to remind my patients of that, because it's easy to lose sight of that,
Mhm.
especially in the level of constant craze and stress and kind of constant things that we are in the world today. So just that one thing, that one step, and to have grace is something I always say as well.
Yeah, yeah. One step in the right direction, and then take a second step and take baby steps. You don't have to do this all at once, but start looking at what else is on the market, as opposed to using 10 different cleaning supplies in your house where all those chemicals are outgassing in your home. Maybe look at making your own home all-purpose cleaner, just like our parents did, just like they did years ago. Instead of, you can save a lot of money going down this avenue of trying to live a low tox life and being preventative in your measures. It doesn't have to be crazy expensive. Everybody thinks it is. It's not. You shop at a farmer's market, buy your organic produce there, cook more at home. So yes, baby steps and trying to live a much healthier and greener life. And I appreciate everything you have to offer. I look forward to connecting with you again down the road.
And
Um,
I want to try your product, so I'm
yep,
excited.
yep. When we hang up, I'll get your address here so I can uh, ship you one of my Teas Organics all-purpose cleaners.
Awesome.
So thank you, and everybody have a great day,
That's
and
right.
read
Thank you.
your labels and know your ingredients. Namaste.